most people say that this is a very relaxing procedure. So, we'll see how you feel about that at the end. But before we get started, can I just have some personal info just to put it in the system? Okay. What is your full name, including your middle name? Okay, and your date of birth. Okay, and your contact number. Okay, and your current address. Okay. And are you currently on any medications that we should know about? Okay. And do you have any medical conditions or allergies that we should also know about? Okay, perfect. Alright, we are all good to begin. I'm just gonna start off with examining your face and your face muscles. Yeah. Nothing will hurt. Let's put my gloves on. Okay, so a cranial nerve exam is an exam of the 5 senses, that being sight, smell, taste, hearing, and touch. So I have some tests that we're going to be doing on you, but before we do that, I just want to see how your face muscles and symmetry of your face are. Okay, well, let's take a look. Alright, so I'm just going to be touching your face very slightly. Nothing's going to hurt. I just want to feel the muscles and see if they respond. So let's... Okay, alright. And do you mind smiling for me? Okay. You have a very beautiful smile. Okay, and do you mind frowning for me? Okay. It actually takes more muscles to frown than to smile, so we might as well smile more. And do you mind opening your mouth for me? Okay. Perfect. And one last thing, do you mind puffing out your cheeks? Okay. All good. Alright, well, let's just write that. Okay, so we're gonna start off with your visual sense. So I have a couple things that we're going to be doing. Okay, and first is following this light. Okay. Alright, do not move your head, just follow it with your eyes, okay? Good, I'm gonna shut this one eye and just continue. Okay, and good. Let's follow it more. Good, 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 good. Alright. Perfect. Okay, and now, do you mind looking up for me just with your eyes, not with your head? So like that. Okay, and to your left. Alright, to the right. Perfect, and look How many times did you see it? Okay, perfect. We have one last vision test. I am going to point to the row that I want you to tell me the letters in order, okay? So, starting, we're gonna start up here. Okay, and perfect. This row. Okay, and okay, next. Okay, and alright. Okay, and last one. Not last one. Let's see. Okay. Good, good. And can you read this row right here? The row 8. Yeah. That's a little hard. Okay, and what about this right there? Okay, alright. Can you read these two? No? Okay. That's good. That's okay. You did really well on that. Let me just rose and oh yeah. That slight noise is just a patient in the other room. They do some visual or sound hearing tests, and one of them is a frequency sound. So if you hear it, no worries. It should be done soon. Yeah. Alright, one last thing. I'm going to point at a letter, and you just have to tell me what letter I pointed at, okay? Alright, so what letter is good? And good. And this one right here. Okay, perfect. Okay. Okay, and good. Alright, okay. Now we are going to do a smell test. So, the sense of your smell. So, I have a few oils here, and they all have different scents, okay? And I'm just gonna have you tell me which scent is which. So, we have eucalyptus, okay? Peppermint, orange, lavender, and lemongrass. So I'm just gonna, put it right in front of your nose, and you have to tell me which scent you think it is, okay? Perfect. You are doing really good. Let me just record this in my notes. Alright. Okay. We are going to move on to hearing. Okay. And I have a couple things for this, but we are simply going to clean your ears a little bit first, just to get anything that may be blocking your hearing. Sometimes that can happen. Any wax buildups can create a muffled version of sound. So I'm just going to be digging in your ears just a little bit really quickly. Yeah, I'll keep wearing these ones. Alright, let me just get my tool. Alright, so do you mind looking to your left for me? We're gonna start with your right ear. Yeah, okay. Perfect. I'm just gonna get a little close. It's okay though, you can just, nothing will hurt. It might even tickle a little. Yeah. Alright. So, I'm just gonna be looking in here just to see. Okay. Alright. Okay, and it's all good. Just a little bit. Alright, let's see. I'll say it one more time. Cat, crop, can. Alright, and we're gonna go over here. Just once again, tell me what words I say after I say them. Okay. Table, touch, taste. I'll say it one more time. Table, touch, taste. Good, good. Perfect. Alright, just write that. Okay, next I have a Tibetan singing bowl, and I just want you to tell me when you don't hear the sound anymore, okay? So it's going to emit a frequency, and I just want you to tell me when you don't hear it, okay? Alright, I'll do very lightly, okay? Okay. Alright. Okay, and okay, and would you say that's a low vibration or a high vibration to your ears? Okay, let's try it one more time. And also tell me when you don't hear it. Okay, perfect. Next, we have some chimes, and I'm going to be doing the same thing. Tell me when you don't hear the frequency anymore. Okay. Alright, and would you say that's a high frequency or a lower? And does it sound higher or lower from the Tibetan singing bowl? Okay. Tell me when you hear it again. Okay, and tell me when it stops. Okay. Okay. And do these make a different sound in the frequency? I'm gonna hit the first one and then the second. Tell me if you hear any difference. I'm gonna hit them. They're gonna be doing it at the same time. Do you hear any difference? Okay. And now, just one last time, tell me when you don't hear it. Okay. Good. Alright, last but not least, you did very good on everything so far. Let me just... Alright. Now I am going to take these off. Alright, next, tell me what taste this is, and I'm not going to tell you the flavor, so you just have to tell me the taste. So what I want you to do is stick your tongue out. I'm going to do a little drop of a mystery oil, and yeah, it's edible. It's okay if it's in your mouth. I have ones for scent and ones for taste, so tell me what this tastes like. And perfect. Alright, and next, tell me what... Yeah, you don't like that taste. seems to really be working very properly. I have one last little treat before you go for taste. I have some candies, some chocolates. And yeah, this thing is really cool. We do a special for around Valentine's Day. The taste is, tasting chocolates. So we have a strawberry cream, a caramel, a peanut butter, a giraffe. Are you allergic to peanut butter? Okay, vanilla. Oh wait, I can actually look at your allergies. Okay, and a chocolate butter cream, a pecan delight, and yeah, that's it. So let's open it up. I can give you a chocolate, and you just have to tell me which one it is. I'm gonna give it to you, and then you can either, if you need me to read back what chocolates are in here, I will, but you might be able to just taste it. Like peanut butter has a strong taste, but are you ready? Yeah, you don't have to eat all these chocolates. I'll just give you like 3 maybe, okay? Yeah. Alright. I won't touch this one. So we have this one. Okay. Here you go. And you can just taste that. I'll give you a moment to open it. So remember, vanilla cream, truffle, peanut butter, caramel, pecan delight, chocolate butter cream, and strawberry cream. What do you think that one is? Okay. Alright. And next one. Do you want to choose one actually? Okay, that one. Perfect. And here you go. So just tell me what you think that tastes like. Yeah, okay. You like that one? See, you already knew. By picking it, that one would be good. Alright, one last one, and honestly, if you like, you can take all of these chocolates home with you. Yeah, special treat on us. Alright, you can pick the last one. Okay. Here you go. And which one does that one taste like? Okay. Alright. Well, that is it for the taste tests and all of them. Let me just package this up for you to take home with you. Yeah, this thing's really cool. Here you go. This is on us. You did really good at your cranial nerve, and everything is working perfectly. So you don't have to worry. If you have any concerns in the future, just let us know. Let me know, and I will definitely check out your cranial nerve again. Alright, there you go. I hope you have a beautiful day or night, and yeah, just reach out if you have any questions.